Welcome to the Learn Skin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learn Skin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services. If you have a medical concern, please consult with your physician.
Hello, everyone, and thank you again for joining us. So today we wanted to talk about sunscreens. It's obviously one of the most common topics that dermatologists get to talk to our patients about. Raja, how often do you talk to your patients about sunscreens?
Almost never. No, I'm kidding. Of course not. It's like the crux of every question that we get. I feel like almost every visit, especially around the springtime, ends with, what sunscreen should I be using?
Right. And it's not just for obviously protecting from skin cancers. There's a lot of other sun-related dermatoses or skin conditions that having a good sunscreen and knowing how to use it can be very useful to anybody. So that's why we wanted to talk about it today. And I think one of the first questions that I always get, and my patients ask me, is what is SPF? What is that number? What does that mean? And maybe we can talk about that in a few minutes. How is this really calculated?
You know, maybe we should just jump right into that one, because it's almost a good question of what does SPF mean, but what doesn't it mean too? Sometimes we think It means everything. One of the first answers my patients will give me when I ask them, are you thinking about sun protection? I always deep down hope they're going to say, yes, I'm using sun protective clothing, because I think that's the most important thing.
Right.
Which it's okay if they're not always using sun protective clothing, because I want them to also be using their sunscreens. But the first thing they'll say is, oh, I'm using an SPF. It's like SPF has become equated to sunscreen. I don't know if you get the same thing.
SPF, there's just a number. I say, do you use sunscreens? They say, yes, 30, yes, 15, yes, 45.
Right, exactly. It becomes all about SPF. So SPF really is sun protection factor, and they were even toying around with calling it sunburn protection factor. And ultraviolet light has a couple of ways that it affects the skin, and there's a range in ultraviolet light in general. So there's UV A, B, and C. And C, hopefully, as long as we keep our act together with the environment, it's not coming through the ozone. So really, we talk about B and A,
because that would be detrimental.
Oh my God, that would be horrific. Actually, if we started getting see-through, we'd get skin cancers going through the roof, because it's actually very potently damaging.
Right.
So, yeah, be careful on your Antarctic trips, I suppose.
Yes.
Isn't it one of the polar caps? I can't remember now. But
yes,
that being said, yeah, and pilots. But yeah, with B, and the way I think about it is B is for burning, A is for aging. It's not like a clear-cut demarcation, but most SPF is looking at how well do you protect against the redness that comes from sunscreen. And that relates to UVB primarily. And so, you know, if you have an SPF of 10, for example, if it took me, say I have really light skin and I burn within a minute, if I wear something with SPF 10 and I get that full SPF, then it'll take me 10 minutes before I get to what we call minimal erythemal dose.
And I think it's very important that you mentioned that full SPF, because really the way they test it, they really lather it on, almost like we put it on peanut butter, a sandwich. They really put it on really nice and thick. And most people that I know would put sunscreen on as thin as they could, because nobody wants to see it. So just keep that in mind as you go through this calculation, saying 10, well, if you're putting it really, really thin, and you may not even getting the full 10. Not to mention error in application. You know, sometimes you apply it. If you have a spray, sometimes it's easier to do it more evenly, but with your hand, it's not as even. So when you apply it and you think about 10 or 15 or 30, you have to think about it. This has been applied thick on the entire area to give you that protection. So it's not easy necessarily to achieve that.
Yeah, I think it's a good point, especially when you look at SPF. I think important fact is the FDA requires the testing to be done at 2 milligrams per centimeter squared. But there have been a lot of tests looking at this, and you think, oh, the general public doesn't know how to apply because they need to be trained. They looked at this in dermatologists. And they looked at dermatologists applying it. And
yes,
the amount that we apply it is 0.5 to 1 milligram per centimeter squared. And as much as we want to cry about people need to apply it properly, at some point it becomes uncomfortable. And so we have to account for that when we start thinking about sunscreens. One of the things that you pointed out, with sprays, sometimes with the spray, you might be doing like a community service, because you might be spraying the person next to you too. So, when you spray, sometimes I have to tell people, spray it into your hand and get a nice even coat. I mean, if you spray on your body, that's great too, but make sure you rub it in. But anyway, getting back to what you're saying, so SPF changes. Every time you go down to half, and most people wear it, like I mentioned, at half of what the testing is, your SPF, so that SPF 30 sunscreen is not 30. It's going to end up being somewhere in between, depending on which studies you look at, anywhere ranging from almost 5 to about 15. And so you're getting a major drop-off in SPF, meaning your protection isn't as good as you think it is.
And now the FDA has moved to different labeling, right? There's at least in the process of suggesting some cutoff numbers and then above that. And that's probably some of the background to why they changed it like that.
Right. They didn't want to promote SPF 100 and SPF, because at some point you get diminishing returns. You get so much, you hit 90% pretty quickly. And then after that, when you go from 50 to 70 to 100, you're not getting that much of an extra benefit. And so the FDA originally cut it off at 50 plus. They're going to increase that a tiny bit. Still.
Yeah, because the more dollars you spend to gain in SPF, you don't gain that much in protection. And that's the reality. Even with applying 30 or 50, you reach pretty high 90s there. And then you have diminishing returns, like you mentioned. So, and I do want to touch a little bit, because we talked about the sprays and talk about different formulations, but maybe we should talk about physical versus chemical blockers and screens, because I think that's a common errors that are made, and those so easy to fix. Because you mentioned the spectrum of UV radiation, and I think that we have to be careful when we think about it to know what really blocks what. So the first thing I tell my patients is the concept between a block and a screen. I tell them, you have a door to your porch. You want a blocking door, not a screen door when a storm comes. You want to block the whole spectrum. You want to block the entire storm. You don't want, just a few rocks to go through. So that's why I personally advocate for zinc oxide as a physical blocker that really does the job across all spectrum. We know sometimes that even, and there's emerging evidence that even light in the visible spectrum can cause some damage. So really, if you want to block, do it the right way.
Yeah, so going back to chemical versus physical blockers, I think maybe we can touch upon UV light in general. So you have UVB, which we know is primarily being measured by this SPF factor, but we have UVA, and for the longest time, we know that UVA is important because it penetrates a little bit deeper. It's actually more abundant in the atmosphere. It's like 90% almost to 95% of what actually comes from sunlight. And it doesn't change that much depending on if it's early in the morning, midday, as opposed to UVB. UVB changes with the time of day, but doesn't change as much with UVA. And it gets down deeper and it breaks down collagen, leads to aging, leads to pigment changes. A lot of photoaging is from UVA. When you look at buying the right sunscreen, you want to look for broad spectrum. But I think what's important to realize is there's only a few ingredients that really allow a sunscreen to be broad spectrum. So most sunscreens, yes, they can block UVB, but we really need to think about broad spectrum and blocking into UVA. I think that's what you're getting at. And then even less than that is this whole notion of blocking high energy blue light, visible light. So.
Right. And I think an important distinction that you're making about aging is, and that's why I like to use the broad spectrum sunscreens, because some people are maybe not be motivated by protecting themselves for skin cancer, but certainly a lot of people want to avoid aging. So when people ask me, what interventions do you have for aging? I say, well, have you considered sunscreen? Because an ounce of prevention, hey. So that is something that is often forgotten, but probably the best thing you can do to prevent the appearance of aging, at least, is to use a good sunscreen regularly.
Yeah, there's no question about that. If we can use sunscreen regularly and then using it, there's a few tips and tricks that I tell patients when using sunscreen. First of all, broad spectrum, just to talk about chemical versus physical. Chemical sunscreens absorb UV light, but they don't really reflect it. They absorb it and then they convert it either to a more stable, what we call free radical, or they can convert it to heat. And you have a few chemicals that are out there, chemical sunscreens that are allowed in America, avobenzone, ecamsol, those are two of them. And it turns out that avobenzone ironically breaks down on light, so they usually have to put in another stabilizer along with it, like octocrylene or one of these other stabilizers. And then with the physical sunscreens, you have titanium dioxide and zinc oxide. And those primarily reflect light. A lot of people think they're equal, but they're not. They actually have slightly different spectrums. Titanium dioxide is much better at blocking UVB, and it starts to drop off as you get to the UVA spectrum, whereas zinc tends to be a bit more even. So if you want to choose a physical sunscreen, I mean, realize that both are physical sunscreens that are broad, but zinc is going to be better at the UVA spectrum and the visible light spectrum.
And I realized this kind of a little later in the game, because I used to say zinc and titanium, but now I really say just zinc is the one, because I think overall in the population, people want to get one thing that they can remember. And so making those distinctions are sometimes it's hard. And so you want to have one name. So I go with zinc. You know, one thing though, when you apply these blockers and go in the sun, and I know I'm in Florida, you start sweating and then you want to jump in the ocean. And a great question that people ask me a lot of time is about sweat and waterproof. And some of them say sweat-proof on them or waterproof on them. What does that actually mean? What do you tell your patients?
Well, the FDA changed some of the rules. You can't use the word waterproof anymore. So you have to use water resistant or very water resistant. And the way the testing goes is, and you're spot on, when they do the testing, it's done in a pool of water, but it's not chlorinated. It's usually not salt water. They're usually not making you tumble around. You know, I wish I always was upright when I go out into the surf, but I inevitably end up like crashing into the sand and whatnot. So, you know, I'm not totally uncoordinated, but I don't think I'm that different from other people. I mean, you're splashing around. Right. So the way they do it is they have you sit for 40 minutes. And when you get out, they look to see is your SPF factor about held up to the same as what it was before. And if you can hold up to 40 minutes of water exposure, and they call it moderate, in quotes, activity, then that's water resistant. If you can get up to 80 minutes, then it's very water resistant. And they don't allow you to towel dry or anything. So I don't know how many people air dry when they go to the pool. I mean, you know, if it's a nice day and whatnot, but many of us will throw the towel on. So I think we have to realize that water resistance has some validity, but realize that if you're in chlorine splashing around or, you know, toweling off, you're not doing it the same way that they did the testing. So your sunscreen is probably much decreased compared to how they do the testing originally in that scenario.
And I do tell patients, you know, you can't avoid sweating, which is another way that the sunscreen may be coming off and kind of, and people really don't like it. I know I personally hate it when it drips around your eyes. So I tell people, you know, you got to do what you got to do. You wipe it off. You get to a dry area, and then you reapply. That's why I love the small samples ones that you can keep in your bag. And I got to say, you alluded to this in the very beginning about sun protective clothing, and we're not talking about this right now. But having a hat on and good sun protecting clothing on is really leaps and bounds into getting yourself protected before you even start putting on the creams, because then you're really providing yourself with good protection that's easy to apply and it's consistently there. You don't have to worry how you put it on. So if you use sunscreen as part of the whole approach there, then the sweat and the waterproof issue is minimized. Obviously, when you're in the pool or in the ocean, when you come out, you know, if you want a towel dry, that's fine. Just realize you got to reapply.
Yeah, absolutely. And also with sweating, there is no sweat resistance test. So if you do the water resistance testing, historically, you've been able to slap on the sweat resistance label. But realize, you know, there is no actual testing for sweat. So I think the same experience you've had, I've had too, where you wear sunscreen and it sometimes does run. And I think going back to your point, which is sun protective clothing really is the best way to protect your skin. I always tell people to start with that. Wear a hat or wear long sleeve that breathes, and then you think of sunscreen as your next line of defense. But I think you have to start with, especially for the forehead. I just tell people wear a cap or something when you're outdoors if you're going to be out for a prolonged period of time. Sometimes it's not possible, and then, you know, you just got to try to pick your sunscreen the best. I have personally found it, you know, I find that the zinc oxide based sunscreens don't run as much for whatever reason.
Yeah, surprisingly. And there's some good formulations on the market as well. Now, really, there's companies doing good work at trying to work on those formulations. And I do agree with you. They don't run as much. I find the ones that are thicker, the ones that are supposed to be waterproof, those are the ones that really sit. And then when you perspire, it really starts running down. And again, you just have to realize and understand how these things are tested, how they're labeled, like you mentioned, to realize what are the shortcomings, where you should really just wipe it off and reapply.
Right.
So,
and the new label is very water resistant. Like I was saying, they can't use waterproof anymore, so it'll be very water resistant.
Right. Okay, so I think let's leave our listeners off with just some practical approaches for applying sunscreens. Kind of, how do you put it all together for your patients?
Yeah, the approach that I take is I think you need to find a sunscreen that works well with why you're using it. And the reason I say that is sometimes the zinc oxide-based sunscreens aren't as elegant. And I think we shouldn't act like all sunscreen is just to go out to the beach and whatnot. I mean, people are sometimes layering this over makeup. They're trying to make it classy and elegant. So regardless, find a broad spectrum sunscreen. The AAD recommends at least SPF 30. I actually tell my patients to go to SPF 50 if they can, just because I know that people don't layer it on as much. And then one practical tip that I give all my patients is put on 2 layers right out of the gate. Put the first layer on and put a second layer on, because we know people usually put it on thin. So if you can put 2 layers on, you've already gotten ahead of the curve, literally and figuratively speaking, because then you're getting a higher SPF. One hole that we have is that we don't know how UVA protection changes when you get thinner applications on. We only know the SPF factors shift, but we don't know how good UVA is. But anyway, 2 layers, and then try to go for something with broad spectrum. Avobenzone, Camsil, zinc. Titanium dioxide is good too, but I really think if you're going to go physical, you need to get some sort of a zinc in there, whether it's micronized or not, something that has zinc in there.
Right. And I have in my clinic a handout of a few products where I actually went to pharmacies around and just looked. And so I have a few name brands that I thought had those right ingredients and looked within a certain price range that I thought was reasonable. And in that handout, I also have a couple links for a couple of companies that I think have done a good job in formulating. Again, my bias is for zinc oxide, but there's certainly others that you can use for your patients. And like you said, they have to try it. You have to buy something and try it. Also, obviously, we sell some in our clinic that I think are useful, but I'm not married to them. I just tell patients, you got to try, you got to experiment, you got to see what you like. I like the idea of applying double, and then the whole thing comes in the context of behavior, when to go outside, when to stay indoors if you can, especially in places like Florida where we really get a sun.
And California.
California, that's really hitting us in good angles throughout the day. So, try to do all your outdoors activity before 10 or 11 and then or after 4 o'clock or so. And then the sun protective clothing. So if you combine everything together, you find that you actually have to, even if you make some errors with the application of the sunscreen, you have some backup in your behavior and the clothing. And then if you do double application, I like that. I'm going to use that one.
So I do have one more tip for folks with darker skin, because, sunscreens aren't always the best looking when you have darker skin. And sometimes
yes, please.
They can sit on your skin a little dark. This is where a lot of people will go to the chemical sunscreens, but believe it or not, you can still stick with zinc too if you get tinted sunscreens and they have iron oxide. And the reason iron oxide is interesting is that, and there's more studies to come on it, but it helps to also block visible light. And so iron oxides I think they're a great option for folks with skin of color, men and women, especially if you can get a nice, elegant zinc oxide formulation, and they usually will put iron oxides in there to tint it. And so realize that looking for something with zinc and iron oxide will give you a much nicer, elegant feel, elegant look. It may actually broaden your protection a tiny bit.
Yeah, thank you for saying that. I forgot to mention about the tinted sunscreens, because those sometimes work as almost as a base for makeup that some of my patients like to use. So yeah. It saved them a step in the morning. All right, I think we're going to wrap it up here. And I want to thank you again for listening. Join us again on our next podcast.
Thank you for tuning in with Dr. Raja and Dr. Hadar. This podcast is brought to you by Learn Skin, leaders in integrative dermatology education. Visit learnskin.com/podcast to explore our many programs. Subscribe today and never miss an episode.